Autoinflammatory diseases on YouTube. Last year, Rheumatology International published a paper called Digital Health Information on Autoinflammatory Diseases, a YouTube Quality Analysis. The authors set the scene by explaining that patients and healthcare professionals look for information on the internet because it can be challenging to get access to specialists in autoinflammatory diseases. Using their expertise as rheumatologists and researchers interested in education, the authors performed a quality analysis of YouTube videos. Here's what they did. In January 2022, they went on YouTube and performed 7 searches using these terms: autoinflammatory diseases, periodic fever syndrome, familial Mediterranean fever, Cryopyrin-associated periodic syndrome, tumor necrosis factor receptor-associated periodic syndrome, adult onset of Still's disease, and systemic juvenile idiopathic arthritis. For each of the 7 searches, they considered the top 20 results. From the 140 videos, they knocked out 5 for being non-English, 7 for being duplicates, and 23 for not addressing the medical topic. That left them with 105 videos for their analysis. Of the 35 videos they knocked out, 7 were CAPS, leaving only 13 videos for the quality analysis for CAPS. Nearly half of the knocked out videos were TRAPS, which lost 17 videos, leaving them with only 3 videos for inclusion. Not great if you have TRAPS. They looked at video duration, number of views, likes, dislikes, comments, uploading source, and target audience. Videos involving a medical doctor were labelled professional, and videos from patients or patient families were labelled private. The categories used were professional, private, pharmaceutical industry, and other, which was based on the uploading source, that is the channel. The target audience was categorized into patients and their families or professionals, which they based on the type of language used, the setting, and the level of medical expertise required to understand the videos. Their pie charts make it easy to see that 78.1% of videos were made by professionals and 65.7% of videos were targeted at professionals. To assess the quality of each video, they used a 1 to 5 scale where 1 is low and 5 is high, but they turned it into a scale of 3 by deciding that either 1 or 2 was low quality, 3 was intermediate, and either 4 or 5 was high quality. This they displayed as a percentage. So the large amount of light colour at the top of every bar in this chart represents low quality, and the dark colour at the bottom represents high quality. Each autoinflammatory category is still separated into the target audiences of either patients or professionals. Look at those poor TRAPS patients. I'm not sure how 3 videos can be meaningfully represented in this way, but the message is clear. The quality of YouTube videos for autoinflammatory diseases across their 7 categories is not high. To assess the reliability of each video, they used a scoring tool called Discern, which asks 5 questions. As a person who makes YouTube videos for an autoinflammatory disease audience, it's a handy list of questions for me to bear in mind. 1. Is the video clear, concise, and understandable? 2. Are valid sources cited? 3. Is the information provided balanced and unbiased? 4. Are additional sources of information listed for patient reference? 5. Does the video address areas of controversy or uncertainty? I assume each yes answer scores 1 point, a score of 5 is good, and a score of 1 is bad. In this last figure, they are trying to show us that there is a correlation between video quality and reliability. The better the quality, the greater the reliability. It's fun to play with data, but that is a bit of a stretch. The study is limited in several ways. They point out the temporal limitation. YouTube changes all the time, and their study is a snapshot from the state of things as they were in January 2022. I started this channel in February 2022, just 1 month later. Hopefully my efforts are helping for CAPS, but I'm not sure how they'd grade me for quality or reliability. They also rightly acknowledge the limitation of the study to being only English and only YouTube. I would also argue that the expertise of the authors is a limitation, and that patient input to future studies like this would give more meaningful results. With that said, I'm happy to see a paper like this get published at all. I'm always happy to see autoinflammatory diseases on anyone's radar. I've said myself that resources are lacking, and that's part of the reason I started this channel. I mean, it's also a big part of what drove me to study in the first place. My videos are not high quality, but I think I'm doing okay on reliability. And I'd love someone else to jump in and do this better than me. But I'm also just CAPS. Who's going to do this for the other autoinflammatory diseases like TRAPS and the ones not even mentioned in this study? This paper clearly highlights the lack of and the need for quality, reliable and understandable educational resources on YouTube for rare autoinflammatory patients, their families and healthcare providers. Unfortunately, it stops short of offering any kind of solution, and 2 years on, I reckon they'd probably find the same results if they ran their analysis again.